Hi, I'm Helene Gale, President and CEO of CARE. I'd like to introduce you to CARE's work and the people at the heart of our mission to fight global poverty. We'll journey around the world and meet women and girls who are working with CARE to build better futures for themselves, their families, and their communities. Now, I'm often asked why CARE focuses on women and girls. It's not as if poverty doesn't affect men and boys too. But when we shine a spotlight on women and girls, we reveal the patterns of discrimination and inequality that hold whole communities back. CARE's goal is to see all people everywhere living free from the shackles of poverty. And our 6 decades of experience tell us that when a woman speaks of improvements and new possibilities in her life, she's speaking about change for everyone around her. It's nearly universal. Women who have had the opportunity to learn, value education for their children. Women who earn their own income, invest in their families. And women who are healthy can participate more fully in their societies. The right support can yield lasting benefits for her and everyone her life touches. Take a look.
Le ha salido, ¿no? Porque él quiere estudiar mecánico.
Lorenzo told me his wife didn't stop bleeding after she gave birth. He left her and the baby with his mother-in-law and set out on his bicycle to get help. Pedaling in the dark for 10 miles in pouring rain, he barely made it to town. He finally found a doctor, but by the time they got back to the house, 3 hours had passed. Lorenzo's wife died just as they entered the room. Adolfo, who's now a year old, survived by being breastfed by his aunt. Lorenzo's son Juan dropped out of school to help take care of his brothers and sisters. And Lorenzo's health has worsened since his wife's death. The family is struggling just to survive. For Gladys, the emergency was different, but it could have been just as deadly. The fetus was in a dangerous breech position. A well-trained team performed the emergency C-section. Because Gladys had regular prenatal care and a trained midwife that knew when to refer her to the hospital, she and her baby avoided a potential tragedy. Like most Quechua people her age, 20-year-old Tarsila was born at home. However, 2 years ago, because of the recent improvements, Tarsila's mother decided to give birth to her last child at the health center. Following her mother's example, Tarsila and her husband Jorge came to the local health post to deliver their baby. Basilia assisted. Just hours after giving birth, Tarsila left the hospital with her baby. Basilia and I followed as she, Jorge, and her mother took a taxi to the base of a steep, rugged trail. At 12,000 feet, it was all we could do just to keep up as she made the hour-long climb up to her home with her baby strapped to her back. Tarsila and Jorge's days are filled with hard work and few comforts. But as I watched Basilia instruct Jorge on how to attend to his wife, I had a feeling that Tarsila has what she needs to keep her and her baby healthy. As I walked back down the mountain, I thought to myself, healthcare for the poor can't be solved simply by building more hospitals. What matters is what happens in those hospitals. CARE brought the right people together to create a system that respects local culture and improves the quality of healthcare. The result is women's lives and the families that depend on them are being saved.
Maternal mortality is nothing short of a worldwide epidemic. Nearly every minute of every day, a woman dies from pregnancy-related causes. Almost every death is preventable. We just need the political will and adequate resources to ensure life-saving care is delivered. Now is the time for you to take action. Here are several ways you can speak out on behalf of women around the world. Call your representative or local candidate and ask them to support legislation that expands access to comprehensive maternal health care. Your host can provide you with a sample script. Send a letter to your member of Congress asking them to support one of the many issues on which CARE works: maternal health, basic and girls' education, food security, microfinance, and more. Join us on March 2011 for our National Conference and International Women's Day celebration. You'll learn more about international development and impact policy by demanding a better, safer world for all. Please visit us at care.org/NDA to get more details about the conference and to access useful tools to speak out, like sample letters, representatives' contact information, and more.